Hi everyone, this is Lael Reitler from ARC Benefit Solutions, and I'm joined by Linda Whitford and Courtney Anise, who are from NexBen. They are our payment platform partners. We're really excited to go over ICHRA and all that's involved in having an ICHRA with your group. We really, Linda and I were at the conference, at the Ohio SHRM conference last week, and we really enjoyed meeting a lot of you, playing our fun game, and um, yeah, we're just looking forward to going over all of this. We will have question and answers at the end. It is very possible that this presentation will go the full hour. If it does, Linda and I will stay on and answer any questions that come in. You can also, so just go ahead and write your questions in the chat box. If they're pretty simple, Linda will jump in and try and answer them. But again, we'll definitely answer all of them at the end of the presentation. We are having a $50 Visa gift card raffle at the end of the presentation. So we will do that drawing, and anyone who is still with us at the end of the presentation, before we do the question and answers, they will be entered into that drawing. So you do have to be here the whole presentation to possibly win that. All right, so I'm going to go ahead and hand this over to Courtney, and she'll go ahead and get started with explaining ICHRA to you.
Yeah, thank you, Lael. So glad I could be with you all this afternoon. Excited to tell you a little bit about what an ICHRA is and how it works. As Lael mentioned, Linda and Lael were the faces at the SHRM conference last week, so I'm glad I could be here and chime in to let you know a little bit about what an ICHRA is and how it works. All right. So with that, what we have prepared for you today, we're going to talk a little bit about what's going on in the benefits industry. I'm sure as benefits administrators and employers, things of that, you know what's going on in the industry that's causing some pain points. So we'll cover those at a pretty high level, but what we'll primarily focus on is introducing you to a defined contribution style health benefit through an individual coverage HRA. Then I'll be passing it to Lael. She'll talk to you about setting up an ICHRA. There's just a few simple steps that you go through to get your ICHRA up and running. And we'll wrap up with a case study, and of course we'll have time for those Q&As at the end. So at a high level, there's a few scenarios happening in the current benefits landscape that's creating some discomfort for both you as the employer and your employees as well. The first and foremost in your mind is probably that lack of budget control. It's renewal season and those annual renewal notices start to come out. And some years it's maybe a pretty good year. Maybe it's a 3% renewal increase. And some years it might be a little bit of a tougher pill to swallow. It might be a 30% renewal increase. And no matter what that number is, unfortunately, it's out of your control, right? It's the insurance carriers and the claims experience that's driving that renewal. Another thing that's happening is those participation requirements can limit you as an employer in how many plan options you can offer your employees. Depending on your group size, you might be limited to anywhere from 1 to 3 plan options. And so what's that doing is it's creating this benefits landscape that has really little breadth and depth of benefit offering. And it's becoming increasingly hard for us to meet the needs of all of our employees in this current benefits landscape. So just to dive into each of those concepts in a little bit more detail, I want to talk to you about some studies that were done. The first survey that I have for us to discuss is a survey that was done by Willis Towers Watson. And they, as part of their global benefits survey, had over 25,000 participants from employer groups of all sizes. And they asked them questions around how they were going to control the cost of their healthcare spend. And although employer groups understood that prioritizing controlling the rising healthcare spend cost was a priority. Unfortunately, what Willis Towers Watson found was that over half of the respondents were already over budget. So, what that tells us is that employers cannot keep up with the rising costs. And of course, you know that very intimately as an employer trying to offer benefits to your employees. And we know holistically, employers, you're still covering nearly 80% of the cost of the plan. And so, and in an effort to try to keep that expense off of your employees' plates. Unfortunately, what's also happening on the employee side is that those family premiums have risen faster than wages and inflation. So here we have information from the Kaiser Family Foundation. They did a study back in 2022 as well. And what they found is that premiums have increased 43% over the years. And those family premiums are exceeding the rate of workers' earnings increases. So unfortunately, we're putting our employees in a pretty difficult situation as well. And it's becoming increasingly difficult for those employees to afford those family premiums. So when we talk about cost control, we're really looking at it from two lenses, right? We're looking at it from your standpoint, your viewpoint as the employer, but also we want to make sure that we are offering employees benefits that meet their cost control needs as well. And then a couple other things that are happening in the landscape is that employees are desiring more choice. MetLife did a really great study on the benefits of showing employee care. And they talked about the different ways you can show how you care for your employees. In that study, it was found that yes, health benefits are the number one priority for the employee as far as their benefits package. And what they're really looking for is the ability to have more customizable benefits. And finally, we know that today's workforce is highly mobile, both in transition to new jobs, but also transitioning around the country, right? So younger workers are twice as likely to leave their current job in search of better offers, which creates turnover in your workforce. But also, we have had this shift to remote work. And in that shift, we have employees now that are working all over the country. And so when we think about networks and plan availability and the number of providers that are available to an employee, it's pretty difficult to find one or two plan options that will meet the needs of employees that may be, all across the United States. So at a high level, those are the primary pain points that we're facing in the benefits landscape. And what I'd like to explore today is just one or two ways that you might be able to use an individual coverage HRA to help solve for some of these pain points. Primarily, the idea, as Lael mentioned, we're NexBen, we're the technology that really powers up the payment solution. So when we think about benefits administration, we want to think about how we can streamline it, how we can make it easier for you and your employees. So when we lean into that technology, we think about personalization, 24/7 access, and how we can really streamline that administration. And of course, working with great partners like ARC in this helps ease that administration as well. So at a high level, let's talk about a defined contribution with an ICHRA, that individual coverage HRA. An ICHRA is a way for you as the employer to set a defined contribution amount, and that is a pre-tax fund that employees can use toward the purchase of individual health insurance. So with those dollars, employees then choose their coverage, and they can shop the individual policies that are available to them based on their location. So now they know right away the number of plan options available to them, and they can shop and compare the premiums, the network, the providers, and find a policy that really fits their needs. And so, based on your contribution, they can choose a policy that is over your contribution or under the contribution. Now, if they chose a policy that happens to be above your contribution, that's okay, because any remainder that they might be responsible for can be payroll deducted. It feels very much like a traditional group health plan from the employee's experience. Now, I won't go over the timeline of legislation in too much detail, but the reason why I include this slide is to think back before 2010. Before the Affordable Care Act was put in place, it was actually pretty common for small employers to use ICHRAs as a way to reimburse for individual health insurance policies. Now, there's been some changes and some evolutions along the way, but when ICHRAs were established in 2020, it allowed employers of any size, regardless of if they were small or if they were large, the ability to use ICHRAs to reimburse for individual health insurance policies. So these, an ICHRA might be relatively new, but in concept, it's something that you as the employers, have been doing for many, many years. So let's talk at a high level, a few details of defined contribution and how that contribution actually works. So when you as the employer are collaborating with your benefits team and you're coming up with what your budget is for your benefits, think about your defined contribution as the maximum amount that you would need to reimburse an employee on a monthly basis. So when you're setting that defined contribution amount, there's no minimum or maximum contribution allowance requirements. It's based on what works best for you and your employees. Now, when you define that dollar amount, it does represent the maximum amount that you are required to reimburse on a monthly basis. So if the employee shops for a policy and they don't use all of your contribution, there's no carryover from month to month or year to year. You as the employer will continue to retain any unused contribution. What's the most unique part about an ICHRA is the ability to use different classifications to determine both who is eligible to participate in the ICHRA and how much of a contribution they're eligible to receive. And that's something that as we get into the classification conversations, Lael will cover a couple slides on that. And then another thing is that with a standard ICHRA, it could reimburse for insurance premiums and or qualified medical expenses. Now, with the NexBen ICHRA solution, we focus on the premium payment reimbursement. And so when we think about how our technology powers up that premium reimbursement, it really makes sense why we're going to focus on the process for insurance premiums only. All right, so we have a high level understanding of what an ICHRA is. It's a way for you as the employer to provide funds for the employee to purchase an individual policy. Let's talk about how it can compare to a traditional group health plan. So at its core, an ICHRA is still an employer-sponsored group health plan. So those tax advantages that you receive for offering benefits are still in play. But what is different is where the financial risk it lands, right? So with a traditional group health plan, as we already mentioned, there's no way for you as the employer to control those annual rate increases. And then if you think about self-funding as part of a traditional group health plan, that adds another layer of complexity because unfortunately, as the employer, you can't control the claims history either. right? So maybe one or two bad claims experiences could cause your renewal to skyrocket as well. But when we think about the financial risk when moving to an ICHRA, it's actually pretty low because now your financial risk is limited to what you define as your monthly contribution. You're able to consistently set your healthcare spend month after month because you know exactly what your contribution limit is set to. And you can designate that contribution for each employee class. The great thing about an ICHRA is there are no minimum participation requirements. You can offer an ICHRA to any W-2 employee. So really, it doesn't matter if you're a group of one or a group of 1,000, you can offer an ICHRA. Now, I do see here speed to implementation, 60 days or less. Really, that's flexible. And flexibility, especially as we head into open enrollment, is one of the great components of offering an ICHRA. You know, when we think about the enrollment deadlines for an individual policy, it's really the 15th of the month prior to the effective date. And even that is depending on where you're located, you know, that could change state by state during open enrollment as well. So all of that to say, really work with Lael to determine what is that speed to implementation for your group. Now, from the employee's perspective, there are a couple of things I want to call out when we're comparing an ICHRA to a traditional group health plan. All of the policies that an employee can purchase are ACA compliant. So there's no concern about pre-existing medical conditions or being denied coverage. These are ACA compliant group health plans. So they're going to be those meta level, very ACA oriented plans. Now, the employees, they'll be able to choose from available individual insurance options in their rating area. So if you have employees across the country, the employees shopping in Ohio are going to see the plans available to them based on their zip code. And the employees out of state, you know, if they happen to be in Kentucky, you know, they'll see the policies that are available to them. So it's a very personalized shopping experience. And then I want to touch a moment on portability. What we'll talk about in a moment is those 11 different classifications, but sorry, Lael, I don't mean to steal your thunder. One of those classifications could be part-time employees or seasonal employees. And so we think about portability, the employee owns the plan and they can take it with them. So if you have part-time employees or seasonal employees, and you can offer them employer-sponsored benefits while they're with you at your organization, and they know once the season's over or once their season ends, they can keep their individual policy just minus your employer contribution. That gives you as the employer a reason for that employee to continue to come back to you season after season, right? It gives you the ability to differentiate yourself in other ways that most employers cannot. So as far as portability goes, the employee owns the individual policy and can take it with them should they leave the organization. Again, just minus your contribution. So overall, the ability to control their cost, pick a policy that fits their needs, choose the providers that are in their network, and it all leads to your employees feeling more empowered and more proactive consumers of their health benefits. All right, so that's my spiel that I had for us. I'd like to pass it over to Lael to talk to us about setting up an ICHRA.
Thanks, Courtney. Appreciate it. Some great information there. So This next slides that we'll go over will be you actually deciding to move forward with an ICHRA and what that would look like for your company. So, Courtney, do you want to go ahead and go to the next slide? Okay. I don't know what's coming up next. So, we were having an issue getting the slides over to me, so I'll be surprised with along with you guys to see what the next slide is going to be. So, all right. So the first step would be to pick a start date for that you want the ICHRA to start. So this can be done at any time throughout the year. However, just know that ICHRAs are always going to renew January 1st. So if you were to say, for example, have an ICHRA start November 1, you would literally have a 2-month plan year because it is going to renew January 1st. Do know that if you were to leave your traditional group health plan and move to an ICHRA, the deductibles and max out of pockets will not transfer over to those individual plans. So keep that in mind when you are choosing what kind of start date you'd like for your employees. So being that we're so close to the end of the year, a January 1 effective date would really work out perfect for the employees because typically most health insurance plans do have it set to where those deductibles and max out of pockets are calendar year. So they are all going to reset January 1 anyway. Let's say you already have a health insurance plan in place, maybe it renewed in July. Well, you can actually terminate that plan in the middle of the year. You do not have to continue from July to the next July 2025. You can decide to cancel that and move to an ICHRA come January 1. So just know that you do have those options. Most people are not in a contract, and you are able to cancel from your current plan and go to a ICHRA starting January 1. And then every year, like I said, it will renew January 1st. All right, we can go ahead and go to the next slide.
Would
Courtney?
love to. Yes, I'm okay. Well, please hold.
Well, I'll just also say if you were to move mid-year to an ICHRA, do know that your employees, that's going to trigger a special enrollment period because that is a question I get a lot. But how can they get on an individual plan? It's July and the annual enrollment period is over with. The open enrollment period is over with. When you decide to move to an ICHRA, regardless of when it is throughout the year, that does open up a special enrollment period for your employees and we can get them on an individual plan. All right, so now we're going to talk about classes. There are 11 classes within ICHRAs, meaning you can determine your contribution amount based on a class, but it has to be one of the following 11 classes. So you can choose to have a class with full-time employees, part-time employees, seasonal employees, salaried employees, non-salaried, so your hourly employees, employees who have not satisfied a waiting period. So let's say you have a 90-day waiting period and you have employees that you want to have the ability to have insurance for those first 90 days. Maybe they don't have any coverage any longer. You can have an ICHRA specifically for those 90-day employees. So that's kind of a really cool feature. Non-resident aliens with no US based income. If you're temporary employees of staffing firms, employees that work in different geographic locations. So, like Courtney had said, you might have employees in Kentucky and you might have employees in Ohio. Well, the Kentucky employees, their premiums are different than what the Ohio premiums are. Maybe they're a little bit more. So maybe you want to have your contribution for your Kentucky employees be a little bit higher than what you contribute to your Ohio employees. You will be able to do that by classing those employees out by geography. So the 10th class is employees covered by a collective bargaining arrangement. And then any combination of two or more of those classes that we spoke on. So you could have a full-time class getting $1 amount, and then your part-time employees, maybe you do want to give them something, but not as much as you would for your part-time employees. You can do that. We can also have another one of maybe your salaried employees versus your hourly employees. We want to have different contribution amounts. So we can do all of that via designating classes. So it's a really cool function that's not available in your traditional group health insurance world. And we can really be flexible in how we create these classes and determine how we want to spend those ICHRA dollars based on classes. I think we can move on to the next one, Courtney. Okay, so this just kind of goes up. Yep, we're good because we already really covered that. All right, so determining the budget and contribution allowance. We don't, do we have another slide about this afterwards, Courtney, just so I know? Or is it just the step 4? Okay. All right. So there are no minimum or maximum contributions. So as you know, with your traditional group health insurance plan, most carriers do require that you pay at least 50% of the employee only premium. With an ICHRA, you don't have to do that. You could pay $1. Not that I don't know why you'd want to, but you could. And then you can go as much as you'd want, as you'd like. So that's another really great feature of the ICHRA, that you do have that flexibility to really determine what you want those ICHRA dollars to be for your employees. The one caveat is there is an affordability factor that we do need to discuss. So if so we're gonna, this is a little complicated math we're gonna do. So um, to determine affordability, this is not based on what you think is affordable or your employee, it is per ACA guidelines. You would take the lowest cost silver plan of where your employee resides, and then you take that premium and deduct what the ICHRA dollars are going to cover of that premium. So whatever's left, whatever is the employee would have to pay, if that amount is more than 8.39% of their household income, then the government does determine that that's not affordable. And at that point, the employee can waive the ICHRA and instead get on an on exchange marketplace plan and get premium tax credits, otherwise known as subsidies. So they would be able to do that. Now, if you are a small employer, meaning you are under 50 employees, it doesn't hurt you if they do that. There's no penalties. They're allowed to do that, and it doesn't really affect you. It's just essentially one less employee that you're going to have to pay towards their health insurance. They cannot have both. Just keep that in mind. It's a one or the other type of thing. So they are going to waive that ICHRA dollar amount and get the subsidy instead. However, if you are a 50 plus employee group, you will be, or you could be penalized if your employee goes out and gets subsidy dollars because your ICHRA is not considered affordable. So if you are a 50 plus employee group, we want to make sure, and we will make sure and help make sure that you know this is the minimum that you have to contribute in order to keep that affordability so that you don't get penalized. So that's definitely an important thing to know. And like I said, I will work with you to make sure that we have those contribution amounts to keep it considered affordable per ACA guidelines. And as I spoke to before when we were talking about classes, you can make contribution allowances based on different classes. So we do have a lot of people that maybe give a little bit more towards their salaried employees and a little bit less towards their hourly. And I think we're going to get to in another slide about how we can do that, because there are different ways we can actually do the contributions as well, as far as a flat dollar amount or tiered. So we'll get into that in just a minute. And then, oh, that's kind of like the third bullet, I guess. Within a class, we can do contribution allowances based on age, based on family size. I think, Courtney, is the next slide more about that, or should I be talking about that now?
You can talk to that here. Yeah.
Okay. All right. So we can contribute. You can do a flat amount. Let's say you just want to pay all your employees 400, regardless of if they have spouses, regardless of if they have dependents, regardless of their age. You could do that. Just know that on the individual market, premiums are based on age. So the older you are, the more expensive your health insurance is going to be. So a lot of times that flat dollar amount doesn't sits as well with an employee, because maybe you have a 20-year-old employee whose health insurance is $280. You've decided to give 400 flat to everyone. So his premium is actually nothing out of his pocket. It's going to be at no cost to him. But let's say you have a 60-year-old employee. Again, you're still offering that flat $400. Well, on the individual market, that 60-year-old employee's premium is probably going to be well over $700. So that means now he's going to have to take out of his pocket $300 for an individual health insurance plan. He's not going to be too happy about that, especially if he knows that the 20-year-old isn't having to pay anything. So that's why a lot of times that flat dollar amount doesn't work so well with a group. So what a lot of groups like to do is base their contribution based on age. So you can have your 20-year-old employee, maybe you're going to give him $200 for his health insurance, and then maybe that 60-year-old employee will be $600. So that helps make things a little more even as far as what's going to come out of the employees' pockets. You can do the age-based tiering every year, a different ICHRA dollar amount that you're going to contribute. So all the 20-year-olds are going to get 200, all the 21-year-olds are going to get 210, all the 22-year-olds will get 220, and so on. Or what a lot of employers like to do is tier it to make it a little less complicated, because typically in the individual market, about a 5-year group basing, so from 20 to 25, those premiums aren't going to be much different. So that's a safe way to tier your contributions every 5 years. So your 20, maybe your 18 to 25-year-olds, we're going to give them 200. Your 25 to 30, we're going to increase it by $50 and give them 250, so and so on. And you can do that in any tier grouping. You can do it every 10 years, every 20. But like I said, it seems to be most common that 5 years a good fit, because those premiums don't alter that much, to keep it kind of still equitable with those employees. So the one thing that I do need to point out is that your oldest employees, the ICHRA dollars that you're going to contribute toward your oldest employee cannot be more than 3 times of what you're giving your youngest employee. So if you're giving that 18-year-old employee 200 ICHRA dollars, your 64-year-old employee, you cannot give them 800. You can only give them 3 times that 200. So the most you'd be able to give that 64-year-old employee would be 600. 200 times 3, 600. So we have to keep that 3-to-1 ratio when we're age basing. The other thing that we can do with contributions is we could do it based on family. So we could say employee only, you're going to get the 400, employee plus spouse, we're going to give them 600, employee plus children, we'll give them 700, in our family, we're going to give them 900. So you can do that. Again, it's not the greatest way to do it because all those premiums are going to be based on age, but that is another option of what we can do. And then kind of a fourth option is we can kind of mix all of those together, meaning we can do an age base for your employees. We can decide we're going to do a flat amount for your spouses. So maybe we're just going to give all spouses 300 regardless of age. And then we can also do that for the children as well. So your employees are going to be based on age. Your spouse is going to be a flat 300. And then maybe we're going to do a flat 200 for each child. Now, in the individual world, the carriers do not charge more once you've gotten to your 4th child. So one child might be 200, 2 children, now that's 400, 3 children, that's 600. Well, along comes that 4th child, it's still only going to be 600. 5th child comes along, it's still going to be 600. So a lot of times you can, if you're going to give a flat amount for the children, you can cap it at three children. So whether they have 3 children or 50 children, you're still only going to give 600 at that point. So we know some celebrities that might have many children. So all right. So and then we could also do, maybe you want to age base your employee and also age base the spouse and a flat amount for children. So you can do all of that, or you can decide I'm only going to give money towards my employee. I'm the spouse and children, I'm not going to offer ICHRA dollars for them. So there's a lot of flexibility that we can work with there and really make this personalized to your group, as you see fit to kind of fit within your budget. So, all right, Courtney. Okay, so with ICHRA, you can choose to have the ICHRA dollars pay for not only your insurance premiums, but also your qualified medical expenses. However, the what we do with NexBen is their product only supports covering the health insurance premiums. And that's kind of what we've decided as well. So if you are going to use us, we really only help support the function of the ICHRA dollars only covering your insurance premiums. And the reason being is that if you are going to offer to allow the ICHRA dollars to cover some qualified medical expenses as well, you're going to open it up to a lot more administrative work. And then also, it's going to potentially affect some other things you have in place. So let's say you have an HSA. That if an employee chooses an HSA eligible plan and you, the employer, still want to contribute towards that HSA plan, you can do that if you have a premium only ICHRA plan in place. If you are covering qualified medical expenses, it does make it more complicated and we're going to run into some issues. So same way with the FSA. So you really, if you're just most groups that I have seen that are using an ICHRA, they're just having that premium only ICHRA plan in place and they're not going to have any extra dollars goes towards your medical expenses. But that's a good thing for you as the employer, because let's say you're, Joe Smith, you're going to give him $500 towards his health insurance premiums. Well, maybe he's pretty young and his health insurance premium is only 300, but you've budgeted for that 500. He's only going to use 300. There's 200 left over. Well, guess what? That goes back to you, the employer. So it is a way to actually where you're going to end up saving money by not offering it to cover medical expenses as well. So if you are like I said, if you are going to use ARC Benefit Solutions, we only support the ICHRA plan that's going to cover insurance premiums only. All right, Courtney. Okay, so the like Courtney had said, ICHRA is a group health insurance plan. So it still has to follow all the same compliance and regulations that your traditional health insurance plan has to cover as well. So you're still going to have your SPD, your plan documents, PCORI fees, disclosure requirements, your Form 5500, your 1094 or 1095Bs, all of those things that you're having to do with your traditional plan, we will continue with the ICHRA. And what ARC Benefit Solutions does is help make sure that you know when those documents need to be filed, what documents you need to have. And then NexBen steps in and helps us with the reporting piece of it as well. And they also provide some template documents for the SPD, the plan documents, where ARC will come in and help you make sure that you have those filled out correctly, or in some cases even fill out for you. And then you will still have to go ahead and get those filed with the IRS or wherever they have to be sent. So we want to be a one service that we can really help you with all of the things that you need to have in place to be compliant and have this plan pretty carefree and easy free. And you'll know exactly what steps you'll need to do with our assistance. All right, Courtney. All right, next step. So we've helped you, the employer, we've set up the ICHRA, we've helped you figure out what's the right contribution strategy for your employees. We've gone over what documents need to be in place legally to set the ICHRA up. Next is, okay, the employees. Well, we don't want you to just say, Joe Smith, you have 500, go figure it out. We are going to be there to help your employees. So we are going to work with the employees to quote them, to show them what plans are available in the area where they reside. Let them know this is the ICHRA dollars that are going to be in place for you. This is You can pick a plan that maybe will be less, and that way you don't have to have anything come out of your paycheck, or maybe it'll be more, but maybe it's a little higher benefits, and that's what they're looking for. We're going to help them figure out exactly what's best for them and their family to fit their needs. So a very personalized experience. And then not only that, we're going to do the enrollments for them. So we're not going to say, well, we've helped you. You still have to go figure out how to get enrolled in this. We're going to be there step by step, hand in hand, whatever they need. But not only that, we're going to be there for them throughout the year. So if they have any claim issues, they have anything that comes up they don't understand, or they're having a problem finding, a doctor that's in network, we're going to help them all along the way, all year long, and at renewal. So as long as we're in place with you as with the company, we're going to be there for your employees. It is really important that if you decide to go this route, that you, the employer, stay out of the selection process of your employees selecting a plan. And the reason is because at that point, you are going to not necessarily you won't be following the ICHRA guidelines. So you will be ERISA compliant, but individual plans are not. So once you decide that, if you start telling an employee, well, this is a good plan, you should choose them, or you should choose Anthem because they're a great carrier. Well, now at that point, you're not ERISA compliant and you could have to pay some penalties. So it's really important that you stay out of that process. But that's why you want to have in place a qualified professional that does this for a living that can really help your employees pick those. And that way it eases that off of your plate, because I'm sure you don't want more on your plate, but you know that your employees are in good hands and will help them get the coverage that they're going to need. Courtney, I think are we good? Okay, premium payments. So like Courtney said, we're partnering with them. In a traditional ICHRA, if you did not have a payment platform in place, the way it would work is that everything that we've talked about would be in place. However, your employees would be required to pay those monthly premiums for their individual plans upfront. And then they would provide you documentation showing that they did enroll in an individual qualified individual plan, and then you would reimburse them those dollars. That is a lot of administrative work for you, but also employees don't like that, because a lot of employees live paycheck by paycheck and they don't have $300, $400, $500, $600 to pay all at once. So what we do to help alleviate those pain points is we're partnering, like I said, with NexBen, and they're going to pay those premiums to all the different carriers that your employees have chosen for their individual health insurance premium. So Joe has Anthem, Mary has Aetna, Sally has United Healthcare. Well, NexBen is going to pay each of those premiums for each of those employees up front, so that the employee is not going to have to make those payments. Then NexBen is going to send you, the employer, one bill that you will pay. So it's going to feel very much like your traditional plan, where your employees aren't going to have to be fronting any money. Any portion above the ICHRA dollars can come out of your employee's paycheck. If you have a COBRA 125 placement plan, it can come out pre-tax, as long as we've done an enrollment where we're doing the enrollment direct through the carrier, which most carriers do allow that. There are a couple that don't, but when we're working with your employees, we do let them know, hey, if you choose maybe like CareSource, for example, if you choose CareSource as your carrier, unfortunately, CareSource does not have a direct enrollment platform, so we cannot enroll them direct with CareSource. We would have to go through the marketplace to do the enrollment, which we could, and that's fine. Just the portion that the employee would have to pay out of their pocket would have to be a post-tax basis out of their paychecks. But again, we will explain all of that to your employees. There won't be any surprises for them. So just know this is really where we stand out, because we are going to make sure that the employees don't have to pay anything out of their pocket. It's going to look very similar to you as the employer, where you're just paying that one bill, and then the employees are having their portion come out of their paycheck, just like they've been used to with their traditional plans. Courtney?
Well, that's great. I think that was a great synopsis.
Awesome. So
can I walk
Courtney,
us through this one?
Yeah, walk through that one, Courtney.
Yeah. This is a great case study to just highlight and wrap up all of those benefits of an ICHRA that Lael just talked us through. So this particular organization is a trucking company, a national freight transportation company, who was self-funding their benefits, right? So unfortunately, what this organization was experiencing was their claims history was not great, and they were looking at their third year of a 30% renewal. And so they went to their broker and they said, hey, what can we do about this? And they were able to move to an individual coverage HRA. And they took advantage of the different classifications by rating area. And they took advantage of using the age banding that Lael walked us through, where they set those contributions based on the age of the employee, and they set those 5-year age bands. And what I think is the most important to call out about the cost savings is that, yes, this was a great solution for the employer. They were able to save almost 20% on their health benefit spend, or nearly $90,000, which is very important, right? But then we look at the right-hand side of the chart as well. And I want to call out that the employees were also able to save a significant amount of money on their health insurance premiums. On average, the employees experienced almost a 40% reduction in their insurance premiums, or just over $2,000 on average. And so what that tells us is the employees were also able to look at their health benefit spend, consult with a benefits expert, and find a policy that fit their needs, and in turn were able to save costs as well. So I think this is a great scenario that highlights how moving to a defined contribution through an ICHRA can be a win-win for both the employer and the employee. All right. I think this is time
All
for us
right.
to answer any questions. Or Lael, do
Um,
you have anything you'd like to add?
yes, I actually would like to add a little bit before we just go
Yeah,
over the questions. So a little
yeah,
bit more about partnering with ARC Benefit Solutions. So if you're wanting to see a proposal, because I know that's you want to see what are those numbers going to look like, and that's really important. What am I potentially going to save? Um, there are a few pieces of information that you can provide to me, and then I can get you a real number proposal. We're going to see real numbers of what those potential savings could be. What I will need from you is your most recent renewal. If you don't have your renewal yet, then you can give me what you had last year so I can see what your current plan looks like. So a copy of that renewal package. The other item I will need would be a census. Um, I can provide you a census template so you know what information I'll need, but essentially it's going to be your date of birth, your zip codes, your counties, um, tobacco use. So it's pretty simplified. If you are a large employer, 50 or more employees, I do also recommend that you have the salaries listed for your employees so that I can check for affordability factors when I'm presenting a proposal for you with some potential contribution strategies. The other thing that I would need to know is what is your contribution strategy? Do you have a budget in mind? What do you currently have set up? So that way, like I said, I can present some real comparison numbers to you from what you currently have versus what it would look like for with if you decide to go the ICHRA route. So those are the three pieces I would need, and then I can present a proposal to you. If you are looking for a January 1 proposal, we do not have those individual rates out. They should be out at any time. Well, it's probably going to be another 2 to 3 weeks, honestly. So, but once those are available, then I will be able to present that real number proposal to you. The other thing I do want to let you know, because I'm sure you're like, well, what does it cost? What does it cost? So, there is a cost involved, just like your traditional group health insurance plan, where you are paying a commission for each enrolled employee on your traditional group health plan. It will work the same way with an ICHRA. The cost, if you have under 200 eligible employees, the cost would be $40 per enrolled employee. Not if their families are enrolled as well, there's no charge for that. It's just per enrolled employee. Like I said, same as your traditional health plan. If you have 200 or more employees, then the cost would be $45 per enrolled employee. So just know that that is the cost that you're looking at there. The other thing, kind of my real case, looking at a case solution that like Courtney just went over. So I recently, and this is a big one, and I just like to talk about this because you're like, well, how much like can I really save? How many people were on this case study that Courtney just talked about? Well, I just quoted a 50-person employee group. The employer was paying 100% of the premiums. I quoted an ICHRA for him. They had a their plan wasn't like super great. It was probably about 5 or 6 thousand deductible max out of pocket. When I ran those ICHRA quotes for that ICHRA proposal for that group, they had a $400,000 annual savings. That's huge, and that's off of 50 employees. So think about that compared to potentially your hundreds or thousands of employees that you might have. Just know there are some real savings here that potentially could be had. Now, I'll also tell you, I've quoted groups and there really wasn't a savings, but maybe they did want to continue with the ICHRA because they like the ability to offer ICHRA dollars towards their part-time employees or their temporary employees or their seasonal. So there's still, even if it's not a savings, it's still something that you might want to put in place. But I will let you know both ways. You're not going to save money here, but you potentially could. And the only way you're going to know if you're going to save or not is to get that proposal done. The one thing I didn't talk about, classes, and that just popped into my head, you can keep your traditional group health insurance plan and also have an ICHRA in place. So you could keep that traditional plan for your full-time employees and maybe have an ICHRA in place for your part-time, seasonal, or temporary employees. We can do that. The only caveat to that is you cannot offer an employee the option of one or the other. So if you're keeping your traditional plan for your full-time employees, that's their option, whatever you have on that traditional plan. They can't decide, well, I like the ICHRA, I want to do that. They can't because they're full time. So we can kind of look at that too. And I think that's a big one, especially for people that maybe you really want to do the ICHRA, but you're kind of a little scared to make that change. You could also keep your traditional group plan for your existing employees. And then any new hires that come on, we can install that ICHRA so that you can kind of see what that would look like. And then maybe the following year, you're just going to completely move to an ICHRA. So again, like we keep kind of saying over and over again, so much flexibility with an ICHRA. We can really work to make this work for you and your employees. So now I think we're pretty much done, unless there's anything Courtney thinks I missed. We can go
No.
ahead and answer any questions and answers. Just pop them into the Q&A box. Oh, actually, no, I think Courtney, we wanted to do that drawing. Actually, go ahead and answer some questions and I'll get that drawing set up for you. Any questions and answers. And also just know that there will be a recording of this webinar emailed to you in the next day or two so that you have this, that you can watch at any time. Thank you so much for joining. And I am going to get that raffle put together and then go ahead and ask away your questions.
Yeah, I'll keep my eye on the questions box. I don't see anything in there at this moment, so go ahead and the questions icon should be in the top right-hand corner of your GoToWebinar screen. You should see that little box with a question mark in it. You can go ahead and submit your questions there.
And I'm just having a little trouble because, Jess, if you can give me a call real quick, I don't see all the names and I need to get all the names so I can get this raffle done.
Yeah. If you see at the bottom of our names, there's a listen only attendees.
Okay, I see that.
Yeah. So if you do that drop down.
Okay. Okay, so I'm going to go ahead and do the spinning.
It looks like we do have one question that just came through.
Okay.
Do you want me to read it out?
I say, I'm not seeing that question. Would you mind reading it aloud?
Yeah, that's okay. Question is, what questions do most people ask when you introduce this concept?
I think one of the questions they ask is there a minimum contribution? Are we talking about for the employees? I just want to clarify, are the employees asking the questions or do you mean by an employer?
It says just whoever you introduce this concept to, so I'm assuming the employer.
Okay. So the questions that employers typically ask, and there's actually a lot of questions because there's a lot to this, but usually one of the first that I get is there a minimum participation required? Is there a minimum contribution required? And the answer is no to both of those. There's no minimum participation and there's no minimum contribution. Um, that is really the only, I mean, Courtney, Linda, what is your experience?
Yeah, I think that's one of the common questions too. Sorry, Linda, you can go ahead and chime in.
No, that would be, I'm going to say 9 out of 10 times, that would be a question asked. What is the minimum participation and what is the minimum contribution? They'll also want to know how the payment works. Yes, we're paying the carrier, but they want to understand that a little more and understand the enrollment, how their employee has that assistance to enroll, which Lael did a wonderful job explaining how hand-holding in step she is with the enrollment piece.
Yeah, I think that's a big relief for employers is when they know that they're not sending their employees out on their own to figure out what plan is going to be best for them. And like I said, that's really how we're going to stand out as well because we want to make it as easy for them and we want them to be enrolled in a great plan for them and their family. So that's one of the biggest benefits of an ICHRA is that you're really offering that flexibility for your employee. They're not stuck to the one, two, three employees that you've chosen for all 500 of your employees. They now have many, many more options, many, many more carriers that they can select that best fits them and their needs. And also that takes that administration burden off of your plate because I know how stressful and how much time that you consume in trying to pick the best plan for that many employees. It's not possible, but you have that stress on you and on your plate. Now that's completely taken away from you. So that's really good. Before we continue, I'm just going to announce the winner real quick. It is Georgia Ferris. I'm going to say it wrong. Romanco. Apologize for. So she is the winner of our $50 Visa gift card, and Courtney and Linda will get that mailed to you. If you could send us your address and phone number, probably email address too, just so we have all your contact information. And unfortunately, I'm sorry that our stuff's not on here. Our contact information. Let me see if I can put my contact information so that if you want to email me or call me, you will have that. That's my name. Sorry, I was trying to, and then my phone number, 513. It's in the chat box if you're looking, 9348. So this is my phone number and then my email address. I am putting in next. Please contact me with any questions, or if you just want to go to that next step of let's see a proposal. Just know, doesn't hurt anything to see a proposal. I mean, that is super easy thing to get done for you all. Just provide me some of that basic information that I said. If you don't remember what that is, send me an email and I will send you what pieces I need. And then I can also send you a kind of a written step-by-step guide. So maybe you need to share this with some other people in your organization. I can provide more details for you on that as well. I think, oh, is there more questions? Let me look here.
Yeah.
Could this benefit? Okay, could this benefit employees who have had large claims in last year? So yes, because on the individual market, premiums are not based on claim usage. So it doesn't matter how sick or not sick you are. The premiums are completely based on your age and where you live. That's it. So I assume the premium per employee is based on their no. So I just kind of answered that as well. So yes, premiums are based on age and where you live on the individual market. And at renewal time, it doesn't renew the renewal premiums aren't based on your claim usage. It is always based on age and where you live. So that's one of the great feature of having individual plans. All right. And then, oops, it just closed out. I think we had another. Is it $40 a month employee the cost for your charge? So the $40 per enrolled employee is a cost that is shared. So NexBen gets a portion of that and ARC Benefit Solutions, because NexBen gets a portion because they're providing that payment platform. They're making those payments. They're providing some of that compliance documents that are needed. So, and then ARC Benefit Solutions gets a portion of that because we're providing you with our knowledge and helping you set up the plan and helping your employees get enrolled, doing the enrollments, helping you with all of your regulations and compliance. So that is where that cost is coming from. It is shared between NexBen and ARC Benefit Solutions. And then I think that's all. If there's any other questions, like I said, please feel free to reach out to any of us. I did put my contact information in there in the chat box. And then I can also send an email out to each of everyone that was registered for the webinar with my contact information as well. So really appreciate all of you being on here. I really appreciate talking to you at the conference as well. It was a really great conference. We had a really great time. And I hope that I get to work with all of you really soon. Courtney, Linda, we're all good?
We're
All
good.
right.
Thank you
Okay.
so much for attending.
Yeah, we're good. Thank you so much.
All right. Thank you.
Thank you for having us.
Bye-bye.
Yeah.